They can even start developing borderline diabetes. They can have hypothyroidism. They can have hyperlipidemia, that is high cholesterol levels, and obesity. So all this cluster put together will again cause a variety of disordered symptoms, and they can have mood swings, they can have altered sleep, they can have depression. Then the big I arrives, which is called infertility. Suppose there's a girl who has a cycle of 20 days or a 25-day cycle versus a girl who has a period of 35-day cycle. Who's going to age fast? The girl with a shorter cycle will age fast. She will have an early menopause. So, but when the age crosses beyond 50 years, there can be gradually slowing down of the spermatogenesis, and they can have more chromosomal abnormalities as the age increases. So, the best part is, as of today, we are at the lowest maternal mortality in India, which India has ever seen over centuries.
That's great.
Yeah. So the maternal mortality now is just about 90 per 1 lakh live births. So we are that low.
Hello, everyone. Welcome to the Momcast. This is your safe space. And today, we're talking to one of the most renowned and respected doctors in Bangalore. She's an extremely well-known obstetrician and gynecologist with over 21 years of experience. She specializes in minimally invasive surgery and infertility, and also in high-risk pregnancies. She's a keen advocate of women's health. Without wasting much time, let me introduce you to Dr. Phani Madhuri.
Thank you very much, Amrita, for this warm and sweet welcome. I'm so excited and looking forward to this beautiful podcast, a community where all mothers can come and, have a safe space.
Yeah.
Cheers to Momcast.
Thank you so much. Thank you. That's the plan. Safe space you mentioned. Yes. So let me kickstart this podcast by asking you, why become a doctor?
Right. So, Amrita, I'm a single child of 2 doctor parents. So I grew up knowing only a medical profession. So for a long time, I didn't even know that there were alternate professions. And so I've grown up with just the thought of, becoming doctor from childhood. So, and then that passion just intensified as I was growing up. And right about when I was in 12th standard, when I was about to take a major decision, which branch should I deviate towards, because I was very good in my maths as well. And my maths teacher was very keen that I would pursue engineering. And but then somehow I was gravitated towards medicine. It was always magical a world for me. And eventually I became a doctor and I got very good marks. I got into my dream college, that was Bangalore Medical College. It was my passion to get into BMC at that point, and I was more than excited to be in that medical college. I still like when I feel, the first day when my dad took me to that medical college. In fact, it's the same college from where my father also did his post graduation. So it was even more of a great sentimental value for me to get back into the same medical college as my dad and pursue my medical education.
Wow. BMC is one of India's best colleges, right? From what
Right, Amrita.
Wow.
So Bangalore Medical College is one of the oldest medical colleges in South India and probably the oldest in Karnataka. And it ranks among the top 10 reputed medical colleges in the country. It's got a huge history, and so many wonderful doctors have graduated from that medical college over the years and served the society.
And as I'm sure you continue to serve the society as well. And I know of your keen passion for women's health, hence the question. So now we'll move to the central subject, which is women's overall reproductive health. And I want to start with something very basic, which women across all ages, I'm sure, want more information on, and that is just periods, right? So, doctor, what does a healthy period look like?
So there is no set definition of a healthy period. It is a varied definition. What we mean to say is the period cycle, the cycle duration can vary anywhere between 21 to 35 days. So a 21-day cycle is also called normal, a 35-day cycle is also called normal, and anything in between is also a normal cycle. So you don't have to start panicking if 1 month is a 28-day cycle, the other month is a 35-day cycle. It doesn't mean you're unhealthy. So typically what happens at puberty, that is menarche, when the girl starts her first menstrual cycle, nowadays it can happen anytime between 10 and 12 years because of the better socioeconomic status, better nutritional factors. The girls have started an early menarche, and once the period starts, it doesn't actually follow the clock. So the first few years of your menstruation can have a very erratic, irregular periods. So the girls may face, some of the girls may get periods right on the dot, like monthly cycles. Some girls may take up to 3 to 5 years to regularize the cycles. So initial few years you may just have periods probably once in 2 months, once in 3 months, etc. And slowly they may regularize as you're growing older, because there is something called a HPO axis, which also needs maturation and stability for the periods to become a clockwise regular pattern. So once you've attained like age of 17 to 18 years, usually the periods become very regular. If you maintain your normal body mass index, if you're having regular exercise, regular physical activity, and if your nutrition is good, normally the periods tend to be maintained very well within the 21 to 35-day cycle. So coming to the duration of periods, anywhere between 2 to 7 days is normal. We have so many patients who come and tell me, doctor, I just have a period for 3 days. Is it fine? It is fine. You don't have to start panicking. Okay. So if you have a cycle more than 7 days or 8 days, and if you're continuously bleeding and you're bleeding heavily, say about, you have to change multiple pads throughout the day, you're passing clots. That means to say again, there is a lot of menstrual bleed that is happening. You're persistently becoming weak. You're unable to do your day-to-day routine activities. You're having giddiness, you're having weakness. That means to say you're bleeding much more than the normal, which is roughly about 50 to 60 ml. That's the normal menstrual bleed. But if you're bleeding excessively over the long duration, your blood stops, your hemoglobin starts to drop. So this condition is called as anemia. Once your hemoglobin starts dropping, you will have all these symptoms what I just mentioned of anemia. So that is when we know that you are bleeding much more than the normal, and it will need correction. So the duration can be anywhere between 2 to 7 days.
Right. Yeah, that's very helpful, because I remember growing up, especially in teenage, when girls may not have regular periods and people used to get worried.
Right.
But if they don't stabilize until you're like almost 18 years of age, then it's a normal thing for periods to vary.
Right.
Right now.
The only thing is, so persistently, if the periods are very erratic in the teenage group,
Okay.
and if the child is putting on a lot of weight, more than what is normal, if the child is getting obese, if she's not indulging in any physical activity, if she's eating a lot of processed food, lot of dairy, a lot of non-vegetarian food, and if this is the lifestyle, then we will have to take into this condition into consideration, because it can be one of the predisposing factors for a hormonal disturbance called polycystic ovaries. So this is one of the very early signs, like unusual weight gain, acne, or too much of mostly it can be an unusual weight gain and with very erratic period pattern.
I was going to get into PCOS later, but since we just naturally arrived at it, let's. You mentioned PCOS, doctor. I'm assuming it's the same thing as PCOD.
Well, largely for the general public, both the terminologies are the same.
Right.
So what we mean by polycystic ovarian disease or a syndrome is, this is a metabolic syndrome. Of course, there is a lot of pathology seen in the ovaries, but it can affect everything from your hair to till your toenails. Right? So why is it called a metabolic syndrome is because it affects most of the metabolic symptoms in the body. So typically, the common features of polycystic ovaries is the patient may have irregular periods. That is, the periods may come once in 2 months, 3 months. sometimes once in 6 months. They may not have period for a year, etc. They can have a very unusual weight gain, very rapid, excessive weight gain, which is unexplained. Like they may not be eating as much, but the weight gain is very disproportionate. The third thing is they can have acne, a lot of acne, androgenic acne. We call it androgenic because it's a very male pattern acne. They can also have an androgenic hair loss. That means, they have hair loss much more than the normal and in a very male pattern. That is, they'll have balding in the front and very sparse hair in the front part. So, this is all very classical features of polycystic ovarian disease. Because why is it called androgenic is because there is a very high levels of male hormones in these girls. The LH hormone, what we typically measure on the second day of the periods, is very, very high. This is what is responsible for all the androgenic symptoms that these girls are facing. They can have excessive facial hair, they can have hair over the upper lip, on the chin, which is very annoying. And so these are the typical symptoms. And over a period of time, if this condition is not attended to, they can even start developing borderline diabetes. They can have hypothyroidism. They can have hyperlipidemia, that is high cholesterol levels, and obesity. So all this cluster put together will again cause a variety of disordered symptoms, and they can have mood swings, they can have altered sleep, they can have depression, because all these are interlinked, interconnected. Once you start, you're unable to eat properly, you're unable to sleep, and if they don't exercise, then everything becomes a vicious cycle. Then the big I arrives, which is called infertility. They're always worried. And, and if they get married and they start trying for a baby, they may face fertility issues. Because the main problem with these girls is anovulation. That means, see, why does a normal menstrual cycle happen? That means you are having a hormone production, which is responsible for a ovulation. That means you're releasing an egg or a oocyte, and that is what is responsible for a menstrual cycle. So if the egg is not fertilized, that will get degenerated. You have the second set of hormones produced that dips down, and you have your normal period. Suppose the egg gets fertilized, then you have a pregnancy. In these girls, the main thing that is happening is there is no egg production. That is medically called as anovulation.
Doctor, we'll come to infertility. I want to stay with PCOS for now.
Right.
So, as you were speaking, a lot of dots were connecting in my mind as well. For in my life, the people who I've seen suffering with some of these issues. So, PCOS can start young as well. Like it can start in teenage.
Yes. See, these are hormonal disturbances primarily starting from the ovary. So it is an HPO related dysfunction where, we don't know whether the lifestyle is causing the PCOS or the PCOS is causing the lifestyle disturbances.
So I'm going to pause you there. What is HPO?
That is the hypothalamus pituitary axis, which is what is responsible for the normal functioning of your ovarian and the uterine organs, and also for your normal menstrual cycle. So there is a disconnect between your brain and your the reproductive organs. There is an axis between your brain and the reproductive organs. When there is a dysfunction here, then there's a lot of hormonal disturbances that happen in the reproductive system, which is what is causing high levels of LH production. The LH hormone is actually coming from the brain, and that is at a very high level for these patients.
The luteinizing hormone.
Yes, the luteinizing hormone. And so these girls have features of PCOS quite early on. And if identified and corrected very early on, they can have, they can avoid the adverse effects of this disease later on. Because many people, would have ignored it for the first 5 to 10 years. They would start seeking medical help probably in their late 20s. But this problem would have actually started in their 15, 16, 17 years of age, which is a very slow onset chronic disease. So people don't take notice of it. First of all, acceptance of a condition is very difficult. But nowadays, in the urban population, we have more awareness, we have more acceptance, which is actually very positive for these girls. So, the moment you have an acceptance, you can always seek help. The problem happens when you are in denial. When you are in denial, you don't want to actually seek help. You want it to be autocorrected, which many a times may not happen on its own. It may need some help.
Yeah. People usually don't even find out that they have a PCOS or PCOD until they actually go in for a checkup or when they're planning to conceive a child. Say that's when a
Right.
lot of people do find out that they have this.
Right.
And you're saying that this might have started like 5-10 years in
Absolutely.
advance.
Very true.
Wow. Okay. Which could have then led to a difficulty in conceiving.
Absolutely. The more the
Right.
chronicity of the disease, the more
Mhm.
the treatment is needed. If you
Right,
attack a
right, right.
condition very early on, see, these are
Right.
all chronic conditions. Why do we call them chronic? They're going to be with you for a long period of time in your life.
Mhm.
It's not a cough or a fever where you take a couple of medicines for a couple of days and it vanishes.
Right.
So this is a lifestyle disease and it's a chronic illness, it's a metabolic syndrome. It will be there for quite some time, where you have to keep modulating your lifestyle, and that's why it's called a lifestyle change, where you need to be doing, where you need to be addressing these things throughout your life. You can't do it for a day or two and expect a radical change.
And can you is polycystic ovarian syndrome a treatable disorder? Can it be?
200%. I wouldn't say it's a treatable in the sense it can be modulated, mended, modified, and kept under control. That is the definition of a treatment in PCOS. So once you have identified this condition, there are various modalities of approach. You have a medical approach, you have a pharmacological approach, you have a lifestyle approach, you have multifaceted approach, a cosmetic approach to treat your cosmetic conditions like your facial hair, etc. So when you have an interplay of all these departments, you can have absolutely a normal, healthy life. You don't really have to panic. But you need to identify, see, a patient may not have all the components of the disease together. There'll be one component which is going to be a dominant component. So we need to identify that needs to be targeted, that needs to be acted upon and taken care of.
Because often what I've also seen is that, okay, once somebody has conceived, now they don't really care that there's a disease in their body and they're not treating it as actively as they should. Lifestyle changes come at the very end often. Right. But if left untreated, it can then lead to diabetes and you mentioned other complications as well. Right?
Definitely. So awareness is very important. So in initial few years, people just ignore, okay, she's just becoming a chubby child. Probably she's eating too many chocolates. She's having too many pizzas. That's the reason she's just putting on weight. Not many mothers pay attention to it. And sometimes the child may be lazy. They're having too much of screen time. They don't want to go out and play. These are the small, subtle things that you can, as a parent, take note of, start acting on it at a very early stage. And, you can combat most of these problems.
Then would you say that reproductive health checkup in women should start once they have their periods?
No. That is not actually what we would recommend.
Okay.
Reproductive health, in the sense I think what you would want to be interested is, whether I can mother a baby, whether, I'm healthy enough to carry a pregnancy and how my pregnancy will go. Right? So by dictum, reproductive health peaks between the age of 20-25 for all women. I don't know how many of them are aware, but women have a biological clock. Right, Amrita? So the biological clock in women is a very, very beautiful concept where, the eggs, that is the oocytes, which are produced in the ovaries, are actually maximum when we are in our mother's womb. When we are, about 5 months old as a fetus, we have about 7 million oocytes. And by the time we are born, it just drastically reduces to just about 1 to 2 million. And this number will further deteriorate by the age of puberty to just about 3 to 4 lakhs. And you know how many eggs are produced in the entire reproductive life, which roughly ranges between 15 to 30 or 45 years of age. We just have about 400 eggs which are released out of these 2 million that we are born with. Okay. So by the time we are about 50 years of age, we're just left with few thousands, like probably less than 1,000 oocytes. And that is the reason why the periods stop at that point of time, and we call that a menopause.
Right.
So we are born with a fixed number, and the number keeps on deteriorating as we age. Now, this aging is not standardized across all population. There are some women who age fast.
Right.
There are some women who age slow. So the fast aging group, typically, like for as a layman, if you want to understand, if the person is having more frequent cycles, obviously their aging is fast. Suppose there's a girl who has a cycle of 20 days or a 25-day cycle versus a girl who has a period of 35-day cycle. Who's going to age fast? The girl with a shorter cycle will age fast. She will have an early menopause as compared to the one who has a 35-day cycle. And a person who starts period very early on. There's a girl who started period at age 10 versus a girl who started at age 15. Obviously, the girl with age 10 will have an early menopause as compared to the girl who started a period at age 50. There is a lot of racial impact on this whole scenario as well. So Asians tend to have faster aging. We generally have an early menarche. We have a reproductive, very early on reproductive peak. And our reproductive aging deteriorates very fast after the age of 30 to 35 years.
Wow.
And it's negligible after the age of 40 years. So, we have to keep these things in mind.
Which is why I guess when somebody's 35 and pregnant, it's called geriatric
Yes, now,
pregnancy,
right.
right?
And a high-risk pregnancy. Yes, right. And so a screening for a reproductive age, yes, you can do it because it's harmless, it's informative, it helps you in decision making. So why not? You can do it. But I wouldn't ask you to do it at the onset of your periods. So probably you can wait till the age of 20 to 21. And you can have a basic screening, which involves just an ultrasound and some simple blood test during the second or third day of your periods, which involves your AMH, which involves your FSH, and your LH. So these three hormones together, along with a simple second or third day ultrasound, gives you a fairly good information as to what is your reproductive health. Right? But it is not a foolproof method of telling you that, yes, you're definitely going to have a uneventful reproductive journey. Right. So because everything being normal, also there is a huge set of populations, about 30% of the infertility patients, which are called unexplained infertility. This is a group of patients where every report is actually normal. So they have problems at a molecular level, at a genetic level, which is what is causing them to have fertility issues.
I was going to come to infertility and specifically how much of it is due to genetics. But we'll come to that later. I'm going to come back to periods and ask you that we already discussed that, irregularity in periods can be due to polycystic ovarian syndrome and so on and so forth. And it can also lead to other much more complicated, grievous diseases. What other issues, what other menstrual issues apart from PCOS are there that people can face? Right.
So I mentioned to you about short cycles.
Yes.
A girl is having very short cycles very early on. We've seen a lot of patients off late, Amrita, and it's very disheartening for us as clinicians. Young girls between the age of 20 to 21, they come with very low AMH. And the only symptom they have is very short cycles, sometimes spotting in between the cycles. They may have continuous irregular spotting, and they may have very painful periods. They may have various other, problems like continuous heavy bleeding sometimes, which is just not stopping on its own. All these conditions may be possible. So usual problems that we see apart from PCOS in this group is, of course, a low AMH condition that is called premature ovarian aging.
What exactly is AMH, doctor?
AMH is anti-Mullerian hormone. This is one of the tests to identify the ovarian reserve. Like what is your reserve, the ovarian reserve, what you have, and how much further can you, wait, or how fast is your menopause approaching. So this is an indirect marker of telling you how is your reproductive health and, the female hormone production. Okay. So that is one of the common conditions that we see. The second is endometriosis.
So just pausing you there. So basically, a low AMH means that this person is aging faster. They won't be
Right.
able to reproduce that much
Absolutely.
longer.
Absolutely.
Right.
So there is an age specific reference for AMH. So if you're falling lower than the age specific reference, that means to say you're aging faster. Your biological age may be 25, but your ovarian aging may be 35 years.
So then, would you suggest that when people have a reproductive health checkup, AMH is something that they
Yes,
look
that's
for?
what I mentioned.
Yes.
So you have to do a AMH, you have to do a FSH and LH, and a period second day ultrasound scan. So these things give you a fairly good idea as to where you stand in the reproductive scale.
My biology is coming back a little bit. Follicular stimulating hormone, luteinizing hormone. Okay. Right. And you were talking about endometriosis.
Yes, the second common condition that we see in this age group is endometriosis. Now, this is also a very chronic condition, just like your polycystic ovaries. The onset is typically around the time of your menarche. That is when you start your periods. It's a very slow growing autoimmune immune dependent condition where the symptoms may not be just obvious in a day or two. For some women it takes a long period of years, say about 10 to 15 years, for us to visibly see the disease on an ultrasound scan, whereas the patient may be having symptoms and suffering for all the 10 years before this. So the pain is something very typically associated with endometriosis. If you have painful periods, so now there is a guideline where they say that if the pain is severe enough to affect your day-to-day activities, is pursuing you to drop your work or drop your school, that pain needs to be considered pathological. You can't just brush it and ignore it and say it may be just a part of growing up years of pain. So that pain should always point us that there can be a microscopic disease like endometriosis, which may still not be very evident on the reports. But we should keep this in the background and probably treat them in those lines. And always keep a close watch on these girls. Call them for frequent follow-ups. And if you see any evidence of this condition getting obvious, we treat them in the lines of endometriosis, because the only way of diagnosing endometriosis at such early stage is a laparoscopic surgery. We need to put in a camera inside, check in, and confirm the disease. So that may be too invasive for girls like that at that age. So it can be an empirical diagnosis. We can just diagnose based on these symptoms, keep a watch, treat them on those guidelines, and keep them basically informed so that they can have a conscious decision making regarding the future planning.
So many of these conditions that you're mentioning, a lot of it they start early. Like endometriosis starts early with your menarche. It starts early. So a lot of it is about being observant then, and for parents to listen to their children. Absolutely. And to parents are usually observant, but to be aware that this could actually be a medical condition and not just
because we have so many patients who have traveled to minimum 10 clinics, 10 different cities before they've had a diagnosis. It could be just because of lack of awareness. So we are also, even in the medical fraternity, putting in a lot of efforts of teaching even the primary healthcare providers about these conditions, where they need to be attentive, they need to be informative, and take necessary actions. So, doctor, one thing I wanted to ask you is, what can we do apart from seeking medical help to alleviate or to help the patients who have these disorders? Like, does fitness, diet, do they help, and what should we do regarding that? Definitely, Amrita. It has a great impact on these chronic conditions. Especially endometriosis and polycystic ovaries yield very well to modified lifestyle changes. So, if you have a regular, wholesome, whole food diet, you have meals at proper timings, regular meals, you sleep on time, you hydrate very well, and incorporate any kind of exercise like any aerobic exercises or any form of relaxation techniques like yoga, meditation. All this on a whole will help and bring down the disease intensity. So, like I mentioned, endometriosis can be a pro-inflammatory condition. So, having an anti-inflammatory lifestyle, like an anti-inflammatory diet, usually most of these diets cut down on the processed seed oils.
Right.
They cut down on the dairy, non-vegetarian food, hormonal foods, and processed foods, and gluten. So, when you cut down on these things and incorporate some kind of good physical exercise and relaxation techniques and good sleep, it really helps in decreasing the disease intensity and maintaining the disease. So it is known to have a great benefit in these conditions, both in polycystic ovaries and in endometriosis.
Doctor, what do you mean by hormonal foods?
Like we see a lot of dairy and non-vegetarian production happening through induced hormones. We know that because of the mass production and to cater to the growing demands of these foods, there is a lot of injections of hormones. That probably is one of the reasons for early onset menarche, what we are seeing in the last couple of years. So try to avoid these foods, especially for those kids who are highly prone for these hormonal conditions. That is what we mean to say. So even if you're trying to have a non-vegetarian food, try to ask for free-range eggs, free-range poultry, and even when you want to have a dairy, try to have a free-range A2 milk, which has less of pro-inflammatory hormones or pro-inflammatory foods. Yeah.
So, since we talked about it, I would like to further discuss that. Does A2 milk actually have any benefits? Like, I've been hearing a lot about A1 milk
From
versus
whatever
A2 milk.
understanding I have, I think A2 is again free range. We have the native cows which give the milk, and they are not induced with, they have a free range life, and they are not induced with too many hormones for the excessive milk production. And that is why it tends to be more safe and easy for digestion. And a lot of patients also have come back and told us that their symptom management is much easier when they've moved from the the normal milk to the A2 milk.
Less inflammatory.
Yes, yes.
Right. All good things to know.
Right.
Right. Okay. So, doctor, apart from periods, when it comes to overall reproductive health, we mentioned some of the markers. You mentioned AMH. What are the we mentioned the hormones AMH, FSH, LH. Are there any other markers that when you go for a reproductive checkup, you should keep that in mind, that these I should check all of these markers?
Yes. So we do their general checkup as well. So we check them for their hemoglobin, we check them for their sugars, we check their thyroid status. We also check for a hormone called prolactin, which is a stress hormone which tends to be higher in some of the infertile couples. So this is one specific hormone that we check for. We also check for their rubella immunization status. Like we check for a rubella antibody. So rubella is a virus which if you are not immune to, and then you become pregnant, and if you catch an infection during pregnancy, which can be a very silent infection in the mothers, they may be asymptomatic sometimes, but it can have serious adverse effects in the baby, in the fetus. So that's called a congenital rubella syndrome, which is very detrimental. I mean, it can even cause mortality in the fetus. But if not, if the baby is, she gives birth to a baby with a rubella syndrome, the baby can have various defects like congenital heart disease. The baby can have blindness, deafness, and various other disorders. The facial features may be altered. So it is a pretty serious condition which we would want every mother to avoid. So we check them for the rubella immunization, like, whether they have a good level of antibodies against rubella virus. If they don't, then we give them a simple vaccination, a rubella vaccine, and we usually ask them to avoid pregnancy for the next 2 months, and then they can go ahead and start trying for a pregnancy.
So then this would be in the 20 plus category. Right. And how do you catch the rubella infection? It seems very serious.
So rubella virus is there all over. So it is, you can catch anywhere. So yeah, and adults are usually very strong. They don't fall sick. This virus has a very mild prodromal symptoms like fever and malaise and weakness. You may not even notice many a times if you have a good immunity. But like I told you, it can cross the placenta and affect the fetus, which is what is called as a congenital rubella syndrome.
Yeah. Yeah. I would want everybody to be
Right.
immunized.
Right.
Yes. Okay. So, doctor, we were talking about the biological clock, and you mentioned how women, our eggs keep getting decreasing in numbers as we get older, and by the time we are 50, we only have about 1,000. Does this happen to men as well? Do they have a biological clock too?
Well, men have a different unit of production. The
Oh.
spermatogenesis, that is continuous production of sperms that
Sperms,
happens in
yes.
men,
Yeah.
is an ongoing process. It's not like how it is in women where they're born with a set number of sperms. So the onset of spermatogenesis happens around the time of the puberty, and they will have continuous sperm production, which is usually a 72-day cycle. So there's a continuous production, deterioration, that is an ongoing process. So, but
Okay.
when the age crosses beyond 50 years, there can be gradually slowing down of the spermatogenesis, and they can have more chromosomal abnormalities as the age increases. And so, very high paternal age can also be associated with decreased fertility and, of course, chromosomal abnormalities in the fetus, but
Right.
not as significant as what it is
As
seen
it
in
is
women.
for
Yeah.
Right, right. Okay. And when we talk about infertility, I mean, you can correct me if I'm wrong, there do seem to be a lot of cases of infertility in urban India, right? Like every few people, second or third person that I
Right.
talk to, especially in my age group, seems to have some sort of a problem regarding that and is undergoing treatment or is considering.
Right.
Is that as big an issue as it looks like?
Well, now in the urban population, the incidence of infertility is as high as 25 to 30%. That is, one in every five couples probably are having fertility issues. So, this can be because of the late marriages, more of career, aggressive lifestyle, and they're delaying the pregnancy further on in their life, and a lot of lifestyle problems like smoking, alcohol, lack of exercise, sleep disorders. A lot of young population is on mental health issues. They're on medications for mental health. So various problems like this may be associated, and even promiscuity, onset of sexual infections early on. So there are various reasons why this could be happening, but primarily it can be because of the female age advancement, where earlier we would plan children very early on. People would get married in their 20s, early 20s, and mostly have one or two children before the age of 25, which is not seen in the last couple of decades.
Right.
So a lot of women are planning children after the age of 30, 35,
Right.
some even near 40. So,
Yes.
if they have this kind of planning, there is always an option for egg freezing, which young girls need to be aware of. In fact, it should be a part of their education when they're in schools and colleges, where they need to be aware of this primary, right to understand what the reproductive health is and how to safeguard it. So, in case there is a lot of, there is a plan of postponement of reproductive health, this is a backup plan which most of the girls can utilize and harvest the eggs at a young age, keep them frozen for later use.
So when you say a young age, what is the age group where it would be the
So
best?
young is better. Like I said, your peak fertility is between 20 to 25, within 30. So we have girls coming to us for egg freezing at 35, 38, 39, which is not the ideal thing. You don't have anything to harvest at that point and freeze, right? If you're doing it, might as well do it at the right time, which is going to give you the maximum benefit.
Right.
Because egg freezing is a very, very simple option. It's barely painful. It is a very simple needling technique that is used, and there is no cut on the body. And you can, very well use this technique to help postpone your fertility plans.
Right. May save you a lot of pain later on.
Absolutely. Yeah.
Right. So this is something that can really help save people from those infertility treatments. But if one does get there and has to take treatments, like what are the primary ones available? And
Well, if a couple walks into a clinic with a fertility issue, say when do we diagnose them as having fertility issue is when they've had an unprotected intercourse for at least a year and they've been unable to have any kind of pregnancy. So this is when we statutorily put them under the definition of fertility, and we offer them certain investigations to understand as a whole as to why the problem is happening. So this includes investigations for the female partner, for the male partner. Both the partners will be evaluated. So, like I mentioned, there are simple tests done for the female partner, that is your day 2 ultrasound, the hormonal tests, like we mentioned, your AMH, FSH, LH, your general tests, like your hemoglobin, thyroid, prolactin. We also screen them for the STDs like HIV, HPSAG, HCV, VDRL, and we also do the similar test to the male partner. And there's one, obviously, we do the most important test for the male partner, which is the semen analysis. So we will have to take the seminal fluid and check the parameters whether they're good enough for the natural fertility to happen or not.
Right.
And the second important thing for the females is a tubal test, the fallopian tube patency test. So because if you have patent fallopian tubes is when it will help you in the natural fertility. So we got to check if the fallopian tubes are blocked or unblocked.
Right.
So once we complete all these basic investigations, we come to a conclusion as to which category they're falling into. Whether it's a male factor infertility, whether it's a female factor, or it's a tubal factor. So once we understand that, then we proceed with the further treatments.
So when you say tubal factor, whether
If
the
they have a
fallopian
blockade in the
tubes have a
tubes.
blockade.
Yes.
Right.
So like that, we have to categorize them into different categories and offer them appropriate treatments based on the diagnosis.
Right. Got it. And so then moving on to the pregnancy itself, right? We talked about how a delayed pregnancy can be difficult. Not always, but it can be difficult. Right. And so what sort of care should one take while they are pregnant? Right? Like how do you choose your doctor? That is the first thing. How do you choose your caregivers, your hospital, your doctor, and then what sort of care do you take during the pregnancy period itself? And does it differ for different age groups? That's also a thing.
Definitely. Yeah. So, like I said, how to take care of yourself during the pregnancy actually starts from when you are young. So, having a healthy lifestyle starting from your age of puberty will actually reflect upon the 9 months that you go through during your pregnancy.
It's not just that.
It's not just the day when you start getting pregnant. Right? What is your overall health all through the years? Suppose you're pregnant at the age of 25, how healthy have you been in the last 25 years? Is what is going to impact your 9 months of pregnancy. Right? So having a good nutrition. Like I said, young girls should take care of their hemoglobin because they're losing blood. So taking your supplements, vitamin D, vitamin B12, iron supplements if needed, maintaining a regular exercise schedule, sleeping on time, all these are very important. And good diet. Like you need to incorporate at least 2 varieties of fruits and vegetables, have a green plate, multicolored plate. Yeah. So, I have to do everything on its timely basis in order to expect that your body functions normally during this major physiological change that happens in your life, which is called pregnancy.
Which turns everything upside down.
Right. So if you're healthy and fit and you have been very good all through these years, pregnancy is a cakewalk. That is why women used to go through so many pregnancies one after the other seamlessly earlier because their fitness levels were better.
The lifestyle
was better. Yeah. Because here now we are used to the sedentary lifestyle where, we barely do anything. And whatever little we do is also, we think that it is too much, but actually it is not much. It's not much. So that is how we need to prepare our body because it is both physical and mental preparation.
Right.
Okay. Your mental strength comes from your understanding of the condition, what to expect, how to deal with it, and proceed further. So how to choose a hospital and a doctor? I think, today in cities like Bangalore or any other metro cities, we have fantastic options.
Yes.
Most of the hospitals and most of the doctors are very well qualified, and the places are very well equipped to provide one of the top class care for the mothers and children. So I think, take your local reference, take your friend's reference, go to the hospital which is conducive, which is close by, because even, the visits may be multiple sometimes. All the factors, the logistics have to be kept in mind. And of course, you have a first consultation with your doctor, what is a frequency match. If you're getting all your questions answered and you're in a comfortable, happy space with your doctor, you have no fear to discuss, your questions with them. I think that's a very big green flag. You can go about happily and have a smooth ride during your pregnancy and delivery.
Yeah, I am absolutely agree with especially the part that the hospital should be nearby. Because when you're pregnant, you often have, like, you just get scared about some reason, and then you don't, especially in Bangalore, you don't want to get stuck in traffic for half an hour to go see your doctor about something which could be nothing, right? But you were worried and you had to see your doctor. So yeah, the both those things, that the doctor needs to be nearby and the doctor needs to be somebody you're comfortable with, absolutely essential. So say somebody who, people, they might have been in good health, but say they're not in optimal health when they become pregnant, right? I understand that the first trimester people have to take quite a bit of care, right? And then how does it go in the first trimester, the second trimester, and the final trimester? How do things change?
Okay. So if you have a planned pregnancy, ideally we would recommend the patients to have one pre-pregnancy checkup if possible, wherein the basic parameters have been checked and we've made sure that the lady is in a good health to go ahead and plan pregnancy. And at this time is when we check the rubella, the virus antibodies. And also we will give them a prenatal vitamin which is called the folic acid, which needs to be started in the periconceptional period. You ideally need to start a couple of months before planning so that you have optimum levels of folic acid in the body and start going ahead and trying for a pregnancy. So once you have conceived, and if you've not had a pre-pregnancy checkup, we again repeat the same tests around the same time of whatever I've mentioned. And we start them with the folic acid vitamin, which needs to be taken regularly, because this is one vitamin which is known to reduce the chances of neural tube defects, which is a potentially lethal problem in the fetus. So taking folic acid can diminish, almost make it zero, the incidence of neural tube defects. And why we call the first trimester a difficult period is there's a lot of hormonal surge during the period, which is what the girl is getting used to, the female is getting used to. So there may be a lot of changes in the body, and she is having a surge of hormones which can be causing so many abnormal symptoms like your digestive issues like nausea, vomiting. The patients can have constipation. They may have difficulty in eating, and they may have sleep disturbances. They may have cramping. They may have various other symptoms, the breast tenderness, feeling of very dull, very low energy. They may have, feeling of weakness, giddiness. All these symptoms are very predominant in the first trimester. Now, this is when the female needs a lot of care. She needs rest. Her body needs time to get used to the new hormones that have been into the body all of a sudden. So slowly over the period of next couple of weeks, say by about 10 to 12 weeks, the human body gets used to these kind of hormonal changes, and slowly they settle down into the pregnancy. The other reason why we call the first trimester critical is because this is a trimester where we actually come to know two important events: whether the pregnancy has happened in the right location and is it a healthy pregnancy. So if the pregnancy is not in the right location, that is the uterus, if it's a tubal pregnancy, that again is a potentially lethal condition. It can affect the life of the mother. So this needs to be identified early on and treated accordingly. And if it's an unhealthy pregnancy, if the pregnancy is not healthy by nature, it's not growing the right way, it again needs to be identified, addressed, and the patient needs to understand how to go about with the kind of abnormal pregnancy she is having. So these are the points that we need to take care of. And usually once they complete the 12th week, that is when we do the preliminary genetic sonogram, wherein we identify the conditions like Down syndrome, Edwards, Patau syndrome. So these are the genetic conditions which are very common chromosomal abnormalities seen in fetus. And if any of these are there, we can offer them appropriate counseling. And the patient can go on further. So once they cross the first trimester, usually the second trimester is uneventful. They have a happy space during that time. They're able to get back to their normal life. They're able to do almost all their routine activities with full spirit. And coming to the third trimester again, because of the growing uterus, they may have physical discomfort. They can have breathing problems. They can have, difficulty in getting up, moving around, running around, do their normal day-to-day activities. So those things are taken care of. We also are more careful towards the last trimester, that towards the end of the third trimester, where always there's a potential chance of getting into labor. They can have a risk of rupture of membranes. So all these things
starts third trimester would be your 7th, 8th, 9th month. So from the 7th month onwards, you have the chance of going into labor, or
yes, that's called a preterm labor. But usually women who are healthy, who don't have any complications in pregnancy, will have an onset of labor after 37 weeks. The total pregnancy duration is about 40 weeks.
40 weeks.
So any chance of labor before 37th week, or any chance of rupture of membranes before that, is called a PROM or a preterm labor, which can be a high risk condition where we need to cater to the care of the newborn, especially because it's a preterm baby. So these are the things that we normally have to keep into consideration. So there is a routine screening that happens, and if we see any of these patients in a high risk zone, so we treat them accordingly. We give them progesterone, we give them uterine relaxants, we treat them for infections to decrease the chances of preterm labor.
Right. So doctor, the first trimester is clearly very critical, but does that mean that one should just rest throughout the first trimester? Can they go about their life? How much activity can they do?
So that again is a very personalized approach. So a person who's been active all throughout, she has good energy levels, there's no restriction. She can go about doing her normal activities. So a person is not used to doing anything before, she has too much of symptoms, then we ask them to take it slow. So it is a very personalized approach. We allow them to do as much as they can. They should not overdo or over stress themselves. So there's no point just pushing yourself when your body is not prepared for. So give it time, understand your body, cater to the immediate symptoms. One day at a time.
One day at a time.
Yeah. So it's always important to just take care of what she has issue, because after a few days or few weeks, those symptoms may never exist. So you just have to address them till that date and take care of them further.
So you would have to be quite observant of your own body,
right?
And what it is that I'm going.
That's why we tell them even diet is a very personal thing. What I tell you is not what people are eating in US. They're not eating in Africa. So eat what suits your body. Eat what you're used to eating all these 25, 30 years. Okay, so if some food is not causing any digestive disturbances, you're able to digest the food well. There's no constipation. That's good for you. So you're free to eat that. You don't have to ask me which is good for me. You know best what is good for you. So stick on to that. Have a food map, have a food chart, and you understand slowly which is good for you, which is not good for you.
But I understand there are certain foods which are mentioned that you shouldn't eat in consume in pregnancy.
So there's no hard and fast rule that there is one potential damaging food. In fact, in most of the allopathic books, we don't even have a mention of these kind of things. But generally, people say that having too much quantity of raw papaya or pineapple, they may have little properties of abortifacients. And any food which is causing constipation, which is causing a GI disturbance, too much of acidity, too much of gastritis, too much of nausea and vomiting. If there are some foods which are aggravating these symptoms, we ask them to keep them away.
Right,
So
right,
stick
right.
on to something which is easy, palatable, easy for digestion,
Right.
and which will have you good energy throughout the day.
Good, rice and khichdi for the win.
Absolutely.
Yeah.
Whatever suits that particular geographical area is also very important, which environmental conditions you're living in. So everything has to be taken into note.
So again, we come back to that they'll have to be very observant of their own body and what is working for them and what is not. And also, the immediate family would need to be very observant too, because it's quite possible that the person themselves is so lost in all these new changes that they're maybe not noticing, right? Certain things. And so the immediate
that's the
family would
reason we
also-
always have that partner with them.
Yes.
So
yes.
whatever information we are passing on to the patient, we always make sure that the partner is aware of it. So even if sometimes they miss it, there is somebody with them who can help them out of the situation.
Right. Yeah. Labor can seem very, very intimidating to people. I know that it felt very intimidating to me, right? So what can you do to prepare yourself for labor?
Well, like I said, it's the 9 months of your journey what dictates the 1 hour of labor, the intense labor, or 2 hours of intense labor that you go through. So it can't be just a very disassociated aspect of your pregnancy. It is your complete journey, how healthy you have been, what has been your medical disorders, how has your pregnancy gone on, what has been your weight gain, what are your basic parameters like your sugars and blood pressure, and whether you've had a natural onset of labor or not. These are the primary things which dictate how easy, smooth, or how difficult your labor is going to be. So, all of us know that when you're going through your 9 months of checkup, there are various things which are, identified, addressed, modulated, taken into control, treated, so that you have a successful pregnancy as well as a smooth labor and a healthy offspring along with a healthy mother. That is the whole intent of having a regular antenatal checkup and doing all this what we have done all 9 months. Otherwise, you might as well come in the 9th month and just deliver. We are there anyways to help you during the labor. You can go back home. You don't have to do this, the whole drill that you do for 9 months, right? So if you fall into this category of a low risk pregnancy with a very smooth pregnancy, an ideal baby weight, which is anywhere around 2.8 to 3.2 for Indian women of normal height, I would say, and you've had a natural onset of labor. That means you start with mild labor pains at home, you have a little bit of a vaginal discharge, you have a little bit of spotting, bleeding. You come to the hospital, say about with a 3 or 4 centimeters of dilatation, and then you have a very easy, either the doctor augments the labor with a little bit of medications or help, and you just progress very smoothly. So, roughly, you dilate about 1 to 1.5 centimeters per hour. Within the next couple of hours, you will be fully dilated. So once you have a fully dilatation, within the next 1 hour, you should be able to push out your baby with least efforts, right? So this is a very happy, smooth labor. But if you have any hindrances during your pregnancy, if you fall into an advanced maternal age, if you have hypertension in pregnancy, if you have diabetes in pregnancy, or any other medical disorder, and if there has been a preterm labor, or there has been a premature rupture of membranes, that means the water bag has been ruptured even before the onset of the true labor pains, or you have not had a labor pain at all, you've crossed your due date, you're post 40 weeks, you've still not had any sign or streak of labor. So this is a category which needs help from the doctor, wherein we again reassess the patient at that point of time. We address all these points, we take everything into consideration, we do the repeat blood check for the mother, and we start giving you the induction protocol. Like we try to induce the labor with the help of medications. There are different medicines available for the same purpose. We choose the medicine based on the condition of the patient at that point, try to augment the labor. So many patients, like say about 60% of them, respond very well to induction, and they will have a smooth progress. And during induction also, we have an intensive monitoring of the baby, because induction is an artificial labor pain. It is an induced labor pain. It is not as natural as what it is. So we have to modulate the intensity of the labor pains based on the baby condition. We know whether the baby is getting stressed out or not because of the intensity of the drugs you're giving. So we keep a strict watch on all these parameters and take you forward. And after all this, patients can have a very successful, smooth delivery with the help of induction as well. But if the baby is very large, that is a large sized baby, that's called a big birth weight, or if the patient is very obese, the patient is not dilating or responding to the induction medicines as per the partogram, we have a certain way the labor has to progress. So we are monitoring these things when you are in the hospital. So if you're not progressing as by the book, we know that there is a halt of labor, there is a distress to the baby, or if the baby passes meconium because of the stress. So the baby is in a bag of water which is clear amniotic fluid. So suppose because of the high intensity of the contractions, the baby is stressed out and the baby passes motion in the amniotic fluid. That has a chance to get into the lungs of the baby. And that can cause chemical pneumonia, fetal distress. The baby can have respiratory issues. So these are all conditions which we take into consideration, based on which we decide now this is the time that we cannot allow the baby to get stressed because of the labor. We need to bring it out as soon as possible. So what are the options? The immediate way to bring out the baby out of the stressful situation is a cesarean section. So that is how we make the decisions as to how the progress should go for each patient. So it's a composite decision, taking a consideration of the mother's health, the baby's health, the nature of the progress of the labor. Everything is taken into consideration.
So, doctor, there's a lot of debate regarding C-section versus natural birth. But from what I understand, and from my own experience as well, it's not something that you can or you should just choose in advance.
Absolutely.
Right? It depends on so many factors: your health, your baby's health, if there are any complications whatsoever. Right? Like you everything could have been good. You might have chosen a natural birth, and then during the labor, you might have to then go for a C-section. But from what I understand, all of these things are some things that our doctors see and are manageable. So, regardless of any of these, the patient should definitely not mentally stress out about labor.
Absolutely.
Right?
Because it can't be a pre-fashioned event. You can't have a pre-planned labor event. We've had patients who come with a labor plan, what they've prepared over the last 9 months, but it has gone completely opposite during those 10 hours of labor. Right? Because these are things which are not under anybody's control, not even under your doctor's control. Suppose a patient is laboring and pushing a baby. There's nobody on this earth who can stop her from laboring and push the baby back and do a cesarean. Right? It's a very natural, instinctive process where if you're laboring, the baby comes out. Whether the doctor is there, whether the nurse is there. Olden days, people used to just deliver at their homes. They would deliver in the fields. You don't need actually help in a very natural onset, natural progress labor. You don't need help. Why there has been an onset of an obstetrical medical care or a labor care was to bring down the mortality and morbidity that was happening to the mothers and the babies during the process of labor. So, the best part is, as of today, we are at the lowest maternal mortality in India, which India has ever seen over centuries.
That's great.
Yeah. So the maternal mortality now is just about 90 per 1 lakh live births. So we are that low. And that is a fantastic achievement, which is because of the composite effort of the government, the doctors, the medical fraternity, and the patient fraternity, where everybody has put an effort to bring down the complications of this beautiful process of labor and delivery.
Yeah,
right?
It's a huge achievement.
So it's a very big achievement, wherein the government has funded so much to bring down the maternal mortality. There has been so much education of the primary healthcare centers, Anganwadi centers, ASHA workers, where they have provided, nutritional supplements to the pregnant ladies, have had multiple places for the women to deliver in a safe circumstances. So that was the whole purpose of monitoring and active intervention of labor, right? So try to take one step at a time. Have faith in your doctor, I would say. Have faith in yourself more than anybody else. And, even every hour of labor may be very difficult for the women who are laboring. But they need to be calm, composed, because you are looking forward to a very tiny life which needs more care at that point of time. You can't get unnecessarily stressed out or burnt out. You need to have that reserve of energy for the major push that you will happen at the last minute, right? Because that is the birth to a new life, which is actually going to safeguard that life for the rest of their life. So it's a very important moment where we need to have a watch on every tiny aspect. It's a multifunctional process where we have to address every small thing and then give that baby that chance.
I'll say this from my experience, though, doctor. It's so difficult to not be stressed out in that situation. That you want to, like, you stress out about not being stressed out.
Absolutely.
Right? You're like, I don't want to be stressed out. It might impact the baby, and you get stressed out about that.
Absolutely.
Right? So, yeah. But yeah, big kudos to all of our doctors for managing this achievement, right? This, again, coming back to the C-section and natural births, even we just mentioned that, women could do this naturally, right, without any help. But the reason the medical intervention and help and all these facilities are required because mortality rate otherwise would be very, very high. But say it's an ideal situation. You mentioned that there was a lady who had an entire birth plan drawn out, right? That is happening more and more. A lot of people want to have choices. I've read so much about natural birth practices like water births and so on and so forth that people want to have. I have no idea about that one, right? So, at what stage can people choose to have something like this? That I have been cleared for a natural birth. I would like to go for a water birth or a hypnotic birth. And are those facilities even available in India? Are they safe? Is this a possibility?
Of course. So whatever you mentioned, like the varieties like water birth or hypnotic birth or giving epidural analgesia, these are all methods of elevating the stress and pain during the labor. They're not going to alter the mechanisms of your labor in any which way, right? Or having a person with you to alleviate the pain, a labor assistant, right? A doula. So these are midwives. All midwives. So these are all methods to alleviate, like you said, not thinking about it itself is a stressful thing. So different people have different thresholds and to stress management. So if somebody needs extra help, yes, all these facilities are available as of today, right? So most of these decisions are made with an interpersonal, whatever chat you've had with your doctor. Your doctor will be able to guide you best as to what are the provisions available in that particular setup and how do they take you forward through the labor, right? Otherwise, the process of labor per se is the same. Okay, so you getting into a bed of water or you having hypnotic sessions for pain alleviation or you having the ball exercises, the doing exercises, music therapy, or having a labor assistant throughout. All these will only make the process more easier, and you will be able to go through the whole challenge in a more smoother way. But when it comes to the technicalities, it still remains the same. We have the monitoring system. We will have to keep a close guard on the maternal parameters and the fetal parameters. And whenever needed, whatever method you're practicing for the labor management, if there is a necessity, we will have to take a call based on the fetal condition, whether the mother will need a cesarean section or she can continue into the labor process.
Right. So, opting for a water birth does not mean that you will only have a natural birth. It could still, it will de-stress you.
Yes.
It will maybe ease your pain also.
Right.
But it's still possible, and you might have a natural birth.
Yes.
But it's also possible that you might still require a C-section.
Absolutely.
In which case you should have the right caregivers present the right doctors present. You can't just do your or go through your labor with only your midwife or only your doula, because you don't really know where your labor, in what direction it might progress.
Absolutely. Because there are some very strong U-turns that can happen during the process of labor. There's a condition called amniotic fluid embolism. It's very unheard of because people don't want to hear most of the time. Everybody knows that a childbirth is a potentially life-threatening event to a mother. No matter how much we don't want to hear that, we know that's a part of the reality, right?
Yeah.
There can be a laboring mother in seconds who can stop breathing, who can arrest, who can have a cardiac arrest, and who can die in seconds. That is the worst nightmare of any obstetrician. And we all pray every day that, we don't have to encounter an event like that. Because, no young lady is prepared for an event like this, And these are one of the common things. What happens when there is a water bag break? There can be a sudden gush of air, which can get into one of your vessels and block the vessels in your lungs, which is called a pulmonary embolism. And that is when the patient arrests suddenly. There have been documented deaths because of this condition. The second thing is, after the birth, the uterus may not contract effectively. There can be a continuous profuse bleeding, which is called postpartum hemorrhage, wherein if the bleeding tendency and the clotting capacity of the mother is ineffective, the continuous bleeding can itself put the patient at jeopardy. The patient can go into hypovolemic shock and lose life in no time. So you need to be very well prepared for all these adverse events, which can happen to anybody. It can happen in the low risk patients as well. So we need to be aware. Sometimes during the voluntary childbirth, if there is no specified cut, we normally give an episiotomy, which is a structured cut that we make in the perineum to allow the easy birth of the baby. Suppose, the patient has not had episiotomy and given birth to a very large baby or a very rapid labor, there can be very erratic cuts in the cervix, and which the cuts may extend into your anal area, which is the area which controls your passage of motion, and it can extend into your urethra, the urine passage area. So, and the bleeding can be very profuse and damaging the near organs, adjoining organs like your urinary area, the bowel area, which is life threatening, as well as it can affect your later on social life. So all these things, and after the birth of the baby may require resuscitation. The baby may need help. It may not cry if it has been stressed because of the long labor. The baby may need oxygen support. The baby may need IV fluids. The baby may need antibiotics if there has been signs of sepsis. If the water bag is broken much ahead and there has been some infection which is seeped into the maternal tract, then the babies may need extra support. So we need to deliver in a place where all the facilities are available to safeguard the life of the mother and the baby. We can't be negligent saying that, okay, this is a very low risk patient, you can deliver at home. Why don't we do that? The reason is this, because nobody can identify the sequence of events in a labor and a delivery. It might go very normal till the very end. And even at the full dilatation, there is something called a second stage arrest. There is something called a shoulder dystocia. If the baby is too large, the head may come out and the shoulders may not come out. The baby's shoulders can get stuck in between the pelvic bones. And you have no choice but to cut the neck bone, or you will have to push back the baby and do a cesarean section under emergency. And there is a very huge risk to the baby's life. There's very high chances of mortality to the baby there. And it's highly traumatic for the mother also. So these are events which we always have to keep track of, whether whatever mode of labor stress management you're doing. These are the basic things that we look out for. So we are okay with any type of stress management that patient volunteers for. Okay, but we will be doing our intensive monitoring for the critical parameters that we need to.
Absolutely. So your all other what people consider birthing procedures, are not exactly birthing procedures, they're just birthing help.
Yes.
Right? Your procedure needs to be governed by your caregivers, your doctors, so that you are in safe hands.
Absolutely.
But honestly, listening to all of this makes me just so much more more thankful for all of the women out there who still give birth. Right? Because while it is very beautiful, the journey of motherhood, it does start on such a taxing um, note, right? On a difficult note, not easy at all. Yeah, thank you, Mom. Right. Okay. So, doctor, once you've gone through such a traumatic event, as traumatic as well as happy, like
Absolutely.
what a paradox.
Tiring, I would say, exhausting.
Yes, exhausting. Yes, exhausting is the main word. Exactly, right. Event. How then? What should you do to then heal? What can you do yourself? You're exhausted, so I'm not. I don't think a mother herself can do so much. She's exhausted and she has to take care of the baby. One thing that nobody tells a new mother is that now you're not going to be able to sleep for at least the next 1 year. You will be sleeping in batches of 2 hours because you will be feeding your baby every 2, 3 or 4 hours, depending on where they are in their growth and development. You won't be able to sleep.
Right.
So then how do they take care of themselves, and how does the immediate family, immediate society take care of a new mother?
Yes. So like you said, it's a very exhaustive, event that happens in any woman's life. Giving birth to a child, no matter whether it's a C-section or it's a natural labor, both are very exhausting, both mentally and physically. So first and foremost, you have to give yourself the recovery time. You need a couple of days to physically heal. And I think, you need a lot of moral and physical help from your family. Having a very strong family support is of great help. But for parents who are, having nuclear families, you can ask for help. You can take help from whatever sources available. Have some help. There's nothing to shy away from it, right? The more the help, the better it is, because you may need it, right? And nutrition is very important. Try to, get back to your normal life as soon as possible. So your doctors are there to help you during the healing process, tell you what exactly you need to do. After the normal labor, it's pretty easy. So you recover instantly, almost within a couple of hours, say about a day, you're back to normal after a normal delivery. You physically, at least, have the capacity to take charge of your life. In a C-section, probably you'll take 2 or 3 days more. But even there, you have a pretty fast recovery nowadays, because the advancement in the surgical technique has been so much well advanced now that it's a very small incision, very minimally invasive procedure, and the surgery duration is very much shortened, and the recovery there is also pretty good. So all you need to at this point, focus on your nutrition and recovery, and sleep is important. So at this hour, like you said, even if it's in batches, try to take rest. Whenever you have free time, use it for your rest. Don't try to, overdo other things. And hydration, very important again. You need to flush out all the toxins from your system. So hydration is very important. And getting back to normal life as early as possible is again very important. Have some time for yourself. Take out that 1 hour for yourself where you're free of all thoughts, all your responsibilities. And, try to do things which actually make you happy. Like even if it's just having that cup of coffee with your friends, going to the temple, or going out and, catching up with something that you're interested in. It's important. You don't have to penalize yourself for that, because the rest of the 20 hours you'll be able to give your fullest to the child, right? And get back to your exercise. I always tell this to the patients. Indulging in some form of exercise is good for your mental and physical health, and will also give you good rest. When you're tired, you have better rest.
True.
Right? Yeah. Just being very inactive, and just because you have labored, being on the bed 24/7 will not help you. Right? Both mentally and physically, it will not help you. People, just because you're lying down on the back for a long time, your back will start hurting. So get up and move around. You can please do all your physical normal activities on a day-to-day routine, but don't overexert yourself. And feeding is more exhaustive than your pregnancy actually. So you need more calorie requirement during your feeding. Feeding is a very exhausting process. So you need to be more gentle to these mothers, give them enough time and space for the feeding mothers, and let them do things at their own pace and in their own fashion. So I would always recommend, them to have some nutritious meal either before or after the feed, and take out some time for yourself and try to catch up on that minimum amount of sleep that you mandate, because without sleep, no, the overall body recovery and healing is slowed down. You need to have that amount of rest. And after a normal delivery, we would always recommend the patients to start doing Kegels exercises, that is the pelvic floor exercises, because there has been a complete damage of the pelvic floor which was holding up your uterus. It has been cut into pieces because of the large baby which has come out through the passage. So you will have to bring back the tissues to the normal strength with the help of exercises, with the help of good nutrition and good rest. All three are very important at this phase. And slowly over the time, you get used to the baby gets used to you, the feeding pattern gets more stabilized, the sleeping pattern gets more stabilized, and you're in a smoother phase as time passes. So I think these are the primary things that you need to keep in mind in the postpartum phase.
I'm glad you addressed the pelvic floor one because I was going to ask you that. Doctor, coming to a subject which surprisingly as women we don't know that much about. We don't know that much about a lot of reproductive health related topics, but especially menopause. Like all we know is, oh, menopause occurs in older women, 50 plus, and your periods stop. And that's all we know about
Right.
menopause. Right? So, what exactly is menopause and how does it affect female health?
Okay. So technically, menopause is defined when you stop having periods for at least 1 year. You don't have a period for about a year, and around the age of 40 and 50, then we call you, technically you have had a menopause. But that is not actually what is the most disturbing thing in this category of women. It is the perimenopause. So what happens is, nearly almost 5 to 10 years before the actual menopause, the hormones start fluctuating. There is a decreasing trend of your estrogen hormone, your ovulatory function dysfunctions, and you will start facing various kind of symptoms, which can range from as simple as mood disturbances, sleep disturbances, tendency to gain a lot of weight, and low energy, brain fog, breast tenderness. These are the simple things, and then the more severe things like hot flashes, and you can have irregularities in your menses. That is something which is very concerning for a lot of patients, where they tend to have abnormal uterine bleeding. That means they can continuously bleed for days together, months together, where it can keep going, and they can again have all signs of anemia. They can lose their hemoglobin and get into a lot of trouble. So this is what is concerning for a lot of women. So even before they hit the physiological menopause, because of these various impending symptoms, to various degree, whichever woman is facing whatever symptoms to their various degree, many of them may end up with a surgical menopause. That is, they may have to undergo a procedure wherein they might have to remove the uterus and end up with a surgical menopause. So, we will have to cater to all these symptoms. So mainly the treatment approach to these women is address what is disturbing them the most, encourage them with lifestyle changes again, more focus on your nutrition, try to have healthy foods, lot of nuts, seeds, whole foods, drink a lot of water, cut down on all the habits like smoking, alcohol, regular exercise, and regular sleep. And of course, some supplements like your calcium supplements, magnesium supplements, vitamin D supplements, vitamin B12, all these can aid. And some of the women may require phytoestrogens. They may even require hormone replacement therapy to alleviate some of these symptoms. And they're taken care of during this phase. So, period stopping per se is actually a happy phase. Most of the women are happy. But
Yeah.
the periods may become more laborious, more continuous, heavy bleeding, and very painful periods. These are the symptoms which actually cause a lot of hindrance in the normal life output of the patients, which is what they're consulting us for on a regular basis.
So it's the things that happen before the menopause
That's
that are
right.
the actual concern.
Absolutely.
And they can be so challenging for certain women that they
Absolutely.
might have to remove the uterus completely.
Right, right.
Wow.
So if they have any pathologies like fibroids, a very common condition that comes up in this age group is adenomyosis. So this is a condition where the plasticity of the uterus is lost. Uterus is a soft, supple organ, and when it bleeds, it has to contract, control the bleeding, and the whole bleeding process has to be a pretty seamless and painless, event. But when the uterus wall has become very thickened, hardened, and rubbery, and there's a lot of blood-filled spots inside the wall of the uterus, the wall is not able to contract effectively. That is when the bleeding pattern just becomes very erratic. The periods become very painful. So all these conditions come up in this age group, which need to be addressed one after the other and taken care of.
And is it just like how periods start earlier these days? Menopauses have also kind of shifted to an earlier age.
Yes, I told you that whoever is having shorter cycles, whoever has had an early menarche, they tend to have early menopause as well.
Right.
Now, coming to the post-menopause, again, you have to deal with all the symptoms of low estrogen. So suddenly your body was used to all these beautiful hormones which you've enjoyed over the last 30 years. And there is a receding trend of all these hormones. So you will start having a lot of issues like sexual dysfunctions, dryness in the vagina, lack of libido, and sleep disturbances, hair and skin changes, hair loss. All these changes happen. And coming to the more systemic side effects, like you can have risk of heart diseases, osteoporosis, that is weakening of the bones. So all these conditions have to be taken into consideration. So strength training, getting some form of exercise, getting back your muscle strength, stabilizing all your joints, this will enhance your quality of life.
Seems to me that for us as a species in general, it's important to be fit. But for women in particular, because we bleed so much and our hormones go up and down so frequently through all the different things. Like at least once a month, they will happen for everybody for periods. Then you get pregnant, your hormones again fluctuate, multiple pregnancies, that sort of a thing. You could have PCOD, you could be going through menopause. That for women, it becomes even more important to like be fit. Otherwise, you'll have all these other things that wouldn't let you catch a break.
Absolutely.
Right.
So, like we say, every decade comes with new challenges in the lifespan of a woman. The puberty has its own challenges. The reproductive life has its own challenges. Then you have your perimenopause, and then you have your menopause. And amidst all these stages, there is always a chance for a malignancy. That means, the precancerous changes and the cancerous changes. That is why the routine screening is very important. We know that, women are highly prone for certain cancers. So that is the reason why there is a screening program given for the general health maintenance of all women. So we have to incorporate all these things into mind when we are seeing a woman. At any stage, we have to kind of take her into a holistic picture, address her in a holistic way, not just target the uterus and the ovaries. We have an entire body to, target. And we have to look at it in a very holistic way.
Right. So, doctor, these days you hear a lot about cervical cancer, right? Is it something that can affect women of all age groups? Like, tell us a little bit about cervical cancer. Who are the right candidates to be vaccinated against cervical cancer? What age group? And how should you even get checked up for you how do you get your checkup for cervical cancer? Because you don't go and thinking that, oh, I'm going to get a checkup for cervical cancer done. So is it something that gets caught in your regular checkups, right? How does one go about it?
Well, the beauty of this cancer, the cervical cancer, now cervix is the lowermost part of the uterus, which roughly is about 2.5 centimeters, which is what actually holds your baby throughout your pregnancy. Otherwise, uterus is a muscular bag. When it's become so huge to carry a 3 kg baby, 4 kg baby, and all the contents inside. What is it actually holding it for all 9 months in its place? That is the cervix, right? That is the strength of the uterus. So now this is the organ which is actually exposed to the exterior through your vagina, So it is exposed to all kind of infections that come into the vaginal tract. And usually these infections start around when you become sexually active. And the most common infections are your HPV infections, that is the human papilloma virus. Now, this particular virus and the infections related to this can be predisposing to cervical cancer. So that is why this is probably one of those rare cancers in the body which a vaccine can prevent. Otherwise, there are not many cancers which a vaccine can prevent. Since this has a very strong propensity for relation with this HPV infection, we have developed a virus vaccine which can target this virus and hence reduce the chances of cervical cancer. So anybody, once they become sexually active, are prone for HPV infections. Now, there are varieties of HPV virus. So many, say about more than 50 or 60 variants in HPV virus. But there are certain strong viruses like 16, 18, 21. These are the routine variants which are having a very strong propensity for cervical cancer. So we have vaccines targeting these strains. We have the quadrivalent vaccine, we have the nanovalent vaccine. So these vaccines are targeting these particular strains. And once you are vaccinated, there is a significant reduction in the incidence of cervical cancer. So ideally, you need to vaccinate yourself before you become sexually active. That is the ideal age group, right? You are protected against the infection even before you are exposed to the infection. So that is the best way. So you can vaccinate girls as young as 9 or 10 years old. So in that age group, you will just require 2 doses of the vaccine, 0 and 2 months. And if you missed out that period, anytime later on also you can get vaccinated wherein you require 3 doses. That is, if you start the 0 dose today, you need another vaccine 2 months later and the third dose 6 months later from the primary dose. So finishing this schedule of vaccination has shown to have very beautiful protection against cervical cancer. You can take this vaccine up to the age of 45 years. So if you missed out before, also it is helpful because you might develop cross immunity to various other infections, as well as it protects you against genitoanal warts. So all this, and also decreases the chances of other STD infections. So it is very beneficial, as well as it has a great help in protection against the cervical cancer. So how to screen for a cervical cancer is we do the simple test called pap smear.
Right,
so after the age of 21 or once you become sexually active, you can get the simple test called pap smear, say about once in 3 years or once in 5 years based on what is recommended to you, along with the HPV DNA testing. And once, majority of your reports come normal, you're almost protected against the cancer. So you can carry on screening up to the age of 65 and after that also if needed. So this simple screening technique is good enough in picking up the cancerous or precancerous changes in a very early stage, which can be very effectively treated.
Right. So if you are under 45 years of age and you're not vaccinated and you have a uterus, you should go get yourself vaccinated against cervical cancer.
Absolutely.
Right. Okay. Doctor, I think right now you mentioned a condition, something. What is that an STD?
Yes.
Right. So, because we were coming to STDs. So, please talk us through STDs. From what I understand, STDs are at a rise in India, right? The number is only increasing, and we need more awareness about them. Definitely, we're still not provided enough education, and therefore no sense of how to protect ourselves from STDs.
Right.
Yeah.
So any disease that comes from an infection which is sexually transmitted is called a STD. So we are very well aware of these two conditions called HIV and hepatitis B.
Yes, yes.
But we have not heard of many of the other sexually transmitted infections which are more prevalent and probably are even more damaging also. So there are simple conditions like chlamydia infection. There is something called a gonococcal infection. There is a syphilis. There's a herpes. And there are various other infections which can happen through a sexual contact. So education, like you said, is very, very important. You need to be aware that you can get sick because of a sexual activity. Like any other mucosal tract, even your sexual tract, that the reproductive tract is covered by a mucosal lining. So whenever you have an intercourse, any form of intercourse, like an anal or a vaginal or oral intercourse, the breach in the mucosal, the cuts in the mucosal cavity can lead in the infections through it. And once they enter your bloodstream, they can, cause the disease, right? So having an open discussion, first of all, having a knowledge about this condition is very important. You need to prime young children. Sexual education should be started at school, because we know that now young children, even at schools, are getting exposed to sexual activities. And the lack of awareness at that age itself, can cause so much of a damage by the time they are actually coming to the doctors. So, try to have open discussions with your children. The school should also be able to give quality sex education to the kids, at least from the high school onwards, and in the colleges. And, once they're aware, once the children, both the girl or the boy, are aware of these conditions, they need to have an open discussion before they get into any kind of a sexual contact. You should never hesitate from having a discussion with your partner. There is nothing wrong about it. So we have to inculcate this environment and positive culture of having an open discussion, because an intimate contact is, a potential threat. So having an open discussion with your partner, and trying to understand what are their preferences, and using the right contraceptive is itself enough in reducing, huge number of STDs. Because we have seen, just the lack of this, and, people falling prey to these kind of infections. And, even the habits like your smoking, alcohol, don't try to get into a sexual intimate contact with a person, unknown person, or, under intoxication, because these are all high risk scenarios where you will have extreme high chances of getting into bad infections. So you will have to be careful, and treat it with, quite importance, so that you protect against all these infections and their sequelae, which can be very life threatening later on. Or, some of the infections like your chlamydial infections or your gonococcal infections can spread into the uterus and into the peritoneum, and you can you can have blocked fallopian tubes, hydrosalpinges, pain, and you might need surgeries for those conditions. So you cannot just be very casual about these things. And these infections will not just present over a day. So you might have contact with a sexual infection. It will show its real true color when your immunity goes down. So you never know when your immunity power is low. You might have fallen sick. Your immunity power may be low, and this infection may flare up. So it's very important for you to be aware of all these things. And
again, regular checkup is
yes,
something.
Regular checkup. And even if you've had any kind of a potentially, potential contact, which always better to go get checked and take some medicines which can help you to get rid of the infection immediately.
So, would a pap smear also bring out
Pap
these?
smear is for the cervical cancer
Only
screening.
for cervical cancer.
So if you develop any kind of an excessive vaginal discharge, which is foul smelling, which is irritating to the vagina, you're having continuous red blisters or very painful ulcers in the vagina, don't ignore. Please see your gynecologist or your dermatologist, who are STD specialists, and get them treated, because they can lead, one after the other can lead into different infections. So first you need to be aware of all these things.
Casual sex cannot be too casual when it's when it's a health hazard.
Yes.
Right. Absolutely. And wear contraceptives.
Absolutely. That is definitely. And the contraceptive has to be used even before you have any kind of sexual contact. Even during the, phase where you've not actually ejaculated, you should be using a condom. Because even the contact and the pre-secretions can carry a lot of these viruses. And you can get infection if you've not used the protection in the right way. And try to, when you're removing the condom, also be extremely careful that there are no cuts, and the material does not spill out. And so even if you're exposed to any secretions, you can have potentially any of these infections.
Mm. Yeah, I'm sure that would be very informative
Yes.
to a lot of people, Doctor.
Right.
Yeah. Yeah. Thank you so much. That was a very informative session. I know I learned so much, right? And I know that everybody who watches this is going to get so much information
I'm just hoping
out
so.
of this.
Yeah.
Yes. And I know how you are so passionate about women's health, right? So I'm sure this is going to help a lot of people.
I'd really like to
Yeah.
congratulate you, Amrita, for taking up the effort to put this up. And, you being yourself such a feminist, you would want to do your best, bringing this information to everybody. And, everybody should be aware of their physical and mental health and take the best care so that, we can take care of the next generations.
Yeah, that is absolutely the goal. That's absolutely the goal with this. And yeah, thank you so much, Doctor.
Thank you, Amrita.
Yeah, thank you for your time.
Thank you very much.
So, this was today's discussion, and it was a very special one for me. I'm a new mother, and I know firsthand the challenges that new moms face and will continue to face. So, I hope this video empowers many of you, both men and women. If you're a man, you would like to support your wife or your daughter or whoever female relative is going through this journey. Please share your feedback for this video. Did it help you the way we thought it would? And do share your concerns. What else is there that you would like us to do a podcast about? We are constantly listening to you and trying to provide answers to you, because this is Momcast and this is your safe space. So please like, share, and subscribe to our channel. Share this video with whoever you think requires it, and come back next week for another podcast. Thank you.